had what I would call the case of the series. Okay, the most difficult case of all 8 seasons, where someone attempted at a university in another country to remove a fast-growing tumor on a face. They opened it up, it bled so much, and they closed. We call that a peek and shriek.
So excited for the new season of Botched. 8 years, 8 seasons. That's wild. Did you ever imagine we'd be here in season 8?
Actually, we never even thought we'd be past season 2, for goodness sake, because, we just were talking about this, how lucky we are as individuals and surgeons that we're able to help this many people, this many years. And the best thing for us too, besides helping people, it's taking our surgical skill that we would have never had this opportunity without this wonderful show, Cautionary Tale of improving our level of expertise. So, we're just very grateful and we're blessed that we're here talking to you for season 8.
Season 8 is a different season. Season 8 is an advanced season, and we have a lot more complications. We have an entirely new look to the show. And I think you're going to find it's a lot scarier than you've ever seen before on Botched.
Oh, gosh. Okay. Tell me a little bit about that. What is so scary? Tell me a little bit about that.
So Paul, for example, had what I would call the case of the series. Okay, the most difficult case of all 8 seasons, where someone attempted at a university in another country to remove a fast-growing tumor on a face. They opened it up, it bled so much, and they closed. We call that a peek and shriek. So it continued to grow and literally took over her face. And Paul did some genius work, and wait till you see how it changed her life.
Oh my gosh, that sounds, I was about to ask what the most challenging case for each of you was that season, but that sounds like, Paul, that was your most challenging case ever.
Ever. I mean, on the show, it was, the point is the risks were extremely high.
Yeah.
But I ended up having a fantastic team helping me. But one thing too that we saw this year when he talked about scary is that usually he'll have more patients that need a lot of revisions, because we call this tissue poor protoplasm, bad tissue. This year, because of the trauma sustained in certain parts of the face, I had those patients. Or protoplasm, they would fall apart once you operate on them. And so this is something that we were talking about at season 1, 2, 3, 4, 5, whatever. We would never touch these patients. But now we're just, doing as much as we can, pushing that limit, because we know that patients need to change their lives, and we're going to help them.
I mean, for me, the most challenging case is really the first episode. It was very emotional. Michael, the patient you'll see I did, had a very similar relationship with her father that I have with my daughter. So I shed a tear or two, and I think you will when you hear her story and you see my reaction. And the case was a case that I would have passed on in any of the other seasons, but because of the level we're at now and our abilities and our experience, I mean, we took her on, and I think the results really will show how rewarding it was.
Yeah. Well, and the way you talk about this, just building with all the cases that we've seen both of you take on for the past, 7 seasons that have gotten increasingly more complicated. What is it about those cases that allows you now to take on these cases you would have never even thought about before?
So surgery is like a sport, okay? Believe it or not, the more you do, the better you are, okay? And as opposed to a sport, you can't practice plastic surgery. If you're lucky and get involved in a situation where you get to do an incredibly high volume of difficult patients, you get the practice of surgery behind you, and you can bring that experience to bear on these even more difficult cases. So you're going to see a lot more complicated cases and a lot of complications related to fixing these people.
Absolutely.
We've seen both of you really think on your feet whenever it comes to mid-surgery and during these consultations, trying to figure out something that is going to work. Is there something throughout the seasons, maybe this season, that each of you is particularly proud of coming up with and really pulling it together?
Well, I mean, for me, again, when it comes to this one case, but in addition, there's a lot of patients that I'm operating on in regards to the mouth. And, from trauma to some very tear-jerking stories that trying to figure out different ways to actually fix the mouth without, taking the whole face apart, shall we say. And so we're able to work through that. So for me, besides this gigantic tumor on the face, that has been something I'm pretty proud of.
Yeah, this was a season where I normally have a plan A and a plan B. I don't usually need a plan C, but a lot of these cases, once I opened the patient up, plan A was not usable. Plan B wouldn't be effective at all. So I had to come up on the spot with a plan C. And there were a couple times where I was really concerned it wouldn't work. And then there is a case where I had, during the operation, a true emergency that occurred where we actually kicked the camera people out so we could deal with it. But fortunately, it turned out okay. But you'll see that.
Right. I think we see that moment in the trailer. And what was kind of going through your mind in that moment where you're like, camera's out, now it's time to focus?
They have this expression in surgery and anesthesia where it's 99% boredom, 1% sheer terror. Well, this is 1% of sheer terror that we had to face, where this could be the end of it all right that moment. So it was a true emergency, and we had to sort of go into salvage mode right away.
Jeez. Well, the conversation around plastic surgery has changed so much even since Botched started. I think Botched is probably a part of that as well. How is it for you now putting out season 8 with people knowing more about plastic surgery, with it being a much more open conversation?
One thing that we really enjoy is that people, especially, using their phones, they know everything about plastic surgery. I mean, a lot of our patients will come in really educated. Yeah. And I think what we were talking about earlier is that back in the past, the patients that wanted body modification, 90% would not listen to us and go ahead and proceed, have the bad procedure, and come up with the complication. As a matter of fact, I think 1 or 2 patients, or even 3 or 4, have actually died during. These are patients that we told not to do something. They've actually passed away because of more procedures. Horrible. But now we were talking maybe 75% of the patients are actually heeding our advice and not going to that next step because they're actually afraid.
Yeah, I mean, I like the fact that people are very open now about the plastic surgery they're having and they're thinking about having. I'd like to see that same openness evolve into people using these near miracle weight loss drugs. I think these drugs are a breakthrough. They're here to stay, but we don't really know exactly how to use them. They have a lot more complications in non-diabetics than we really realize. But if we stop people from shaming people for using these like they're cheating, we will learn more quickly how to use them and be able to use them more effectively and safely. So let's stop the Ozempic-shaming. Let's learn how to use them, and tell your doctor if you're on these drugs.
The other aspect that I love adding to that is that, to me, obesity is a disease. But probably both of us. I mean, heart disease, plaque buildup, coronary artery disease, strokes, high blood pressure, diabetes, all the things that happen with your body and when your body shuts down. That's why this is going to help a lot of people that really can't control their diets, and then what happens with that from the subsequent side of getting healthy, then they end up getting a lot of loose skin eventually.
Right.
And so we call that the Ozempic face. For example, when you start losing a lot of the fat and your skin starts to hang down. So we're doing a lot more deep plane facelifts and a lot more body procedures. But again, as time goes on, this is going to become more and more common of these makeovers because of excess skin. But God willing, it's all going to be a good thing as long as you use everything the right way.
Right. So talking about these procedures surrounding, Ozempic and these kinds of drugs, you think that in, 5 to 10 years, it will be similar to the way people talk about liposuction or cool sculpting, those kind of things?
Yeah. I mean, the other thing too is, when patients have a gastric bypass or a balloon or something that is a way to reduce the amount of food going in, and even though there's complications of those procedures, we are saying that there'll be less of those surgical procedures as this becomes more useful. But at the same point, a lot of patients will come in that need, what do you call it? Body lifts, arm lifts, thigh lifts, tummy tucks, facelifts. And so that's all going to happen with this too.
So I think every time a new procedure or new breakthrough occurs, people won't admit to using it and don't want to talk about it. When liposuction first came out, no one would admit it. Same with breast augmentation, certainly same with Botox. And now we're seeing that with these miracle weight loss, Ozempic type drugs. The problem is it's nobody's business if you had liposuction.
Right.
We understood the complications associated with liposuction. We don't really understand how to use safely these Ozempic type drugs in non-diabetics because it's brand new. So it's really important that we stop the shaming, we talk about it, we share our experiences, and we learn how to use it in people who only have 5, 10, 15 pounds to lose. There's nothing wrong with losing it. If using it, there's nothing wrong with using these drugs. And by the way, 15 pounds of excess fat increases your risk of cardiovascular disease, cancer, and diabetes. So I'm all for using them, but let's learn how to use them together.
Yeah, absolutely. Well, you mentioned these lifts and obviously the things that go along with these new drugs that are coming out. But is there any other uptick in procedures that both of you are seeing that feels like a new trend in plastic surgery?
Right, you do yours.
So clearly the next evolution of cosmetic procedures is towards these more non-invasive procedures where you insert little needles in the skin and you apply radio frequency or laser energy or ultrasonic energy. This is the next frontier of plastic surgery. The less cutting and the tightening you can get through the application of these energy transfer systems. The problem is we're seeing a lot of complications from these as well. I mean, when you put a probe with a special new kind of energy transmission device underneath the skin and you start heating up those areas, we're seeing a lot of potential soft tissue damage. So again, it's a new frontier, but we're now seeing new complications related to that.
And, when it comes to that, it's really based on the experience of the physician using it, because you have to make sure it's shall we say, a well-trained surgeon, plastic surgeon doing these procedures. You can't, if you have anyone doing these cosmetic procedures called cosmetic surgeons, that's sometimes when you're going to have more of these risks and complications take place. And one thing that what I'm seeing more of is, so we've always had mostly women would be the neck lift and lower facelift candidates. Maybe 90%, 95%, 5% men. I'm seeing a swing. I'm now seeing because when we're able to do a neck lift, we're able to conceal the incisions very well. And I'm seeing more men, maybe up to 30% as compared to 5% that are coming in getting a well-placed incision neck lift. And that's what I'm seeing, more of a trend, more men not being really worried about getting a lift, especially if we can control the scars.
I think to go back to your earlier question, it's really important that if there is a new type of procedure, you don't want to be first in line for that procedure.
Right.
Other people have it. Let the doctors and the medical professionals get a lot more experience, because we don't really learn what kind of side effects and complications can happen until there's a bigger experience. So don't be first in line with a brand new procedure. And just like these Ozempic type drugs, we're now seeing a lot of new kind of complications, pancreatitis, and all sorts of things that are going on in the hospital that we're just learning about. So don't be first in line.
That is a very good advice. Is there any other advice that you would give to someone who is just kind of dipping their toe in the plastic surgery pool?
When we hear about that, it's always great, one, to have a consult with that, whether it's coming in for fillers and Botox, whether it's, again, the right physician or the right nurse injector going in. I think that doing a little bit of something, whether it's a little bit of filler, a little bit of Botox, one of these procedures that he was talking about, some of the minimally or non-invasive procedures, I think it's fine. As long as you just go in and, like you said, dip your toe into the warm water.
Yeah.
See if you like it. And do it the right way. One of the most important things we want to tell everyone is, though, still, there are places that will offer, even for a newbie or just someone who's been doing it for a long time, permanent filler. We're always going to say no.
Yeah.
FDA approved hyaluronic acids that are reversible,
Mhm.
or something called hydroxyapatite. Stay with that so we don't have the problems and complications.
Yeah, absolutely. And I know we're about to see a bunch of complications. We're about to see some really transformative results on the new season of Botched, which I am super looking forward to. Is there anything else you want to tell people before I let you go for today?
Yeah, there's some competitions you're going to see this year with our wives, and the four of us.
Mm-hmm.
And the loser really has to do something pretty horrible.
Oh, gosh.
We're going to say that. So,
well, I'm nervous.
So this is non-surgical. This is actually a little fun that we have. So you're going to see a little bit more of us having fun together.
Yeah, Botch is a lot more advanced, a lot more emotional. There's
Mhm.
a lot of fun times, a lot of scary times. We've had some complications that you're going to see that we show this season.
Mhm.
So I think this is by far and away our best season, and we're doing cases we never would have even tried before. So stay tuned and keep watching. I think you'll really like it.
Awesome. I am super excited for the new season. I very much appreciate your time today.